If you've been lucky enough to be able to go to dental school and to have what an incredible opportunity it is to be a dentist or a physician, to be able to work in the community is really part and parcel of sort of giving back.
The most significant reason I would say I would want to work in a health center after graduating dental school is the population that you serve. There's all kinds of different people from different countries, different religions, races, and they don't have the same access to dental care that you would normally see in a population in a private practice. They have a lot of medical complications, and they really need well-educated clinicians to be helping them.
Many people say to me, well, why are you in a health center? Believe me, it's one of the most fulfilling jobs I've ever had. It's very challenging academically. The dentistry is very challenging. Not only do you grow as a dentist, but you grow personally.
I feel really good about what I do here because I think that the mission is extremely important. This is a very deserving population to serve, and I had one lecture in dental school and I knew it's exactly what I wanted to do, and I've never regretted it since.
I figured, why not help people who need it the most and who appreciate it more than anyone? And honestly, working here, I do feel appreciated every day, and the patients love to see me and I love to see them.
One of the things that's great about community health centers is that on site there are a range of disciplines, not just dental professionals. There are doctors, nurses, social workers, mental health providers, so they're going to have an opportunity for a multidisciplinary approach.
You have the adult medicine clinic, you have pediatric clinics, you have the women, infants, and children OB clinics, all within 1 or 2 floors of you, so in case you need to pick up the phone and speak directly to a patient of yours, primary care physician, or for whatever the reason, if they need some sort of pre-medication.
For example, if someone had an artificial heart valve or heart problem, they may require antibiotics just before that procedure. They've had certain surgeries. If they're immunocompromised, those are some other reasons.
It's got everything. You're able to treatment plan complex cases. You're able to carry out these complex procedures. You're able to do it in a comfortable environment. It's busy and it's fast-paced, but it's been enjoyable.
You're helping people get out of pain. You bond with that patient. So in terms of dentistry, you grow. Personality, you grow. Spiritually, mentally, you grow. Do I recommend it highly to anyone who's interested?
There were also financial incentives. Now that I'm paying back my student loans is a very good decision.
Massachusetts has, for at least a decade, been very involved in trying to access federal dollars and state dollars to support loan repayment to dental health professionals. We have some state funding and federal funding that supports dentists who are coming out of dental school or dental residency and who are willing to make a commitment to work in a community health center, and to hygienists with similar interests.
Because we all have the burden of loans to pay back, it's nice to be able to have a program where you can be helped in that respect by loan repayment.
So, loan repayment, of course, it's always a good thing because you constantly struggle to pay those bills when you graduate from a professional school. It's going to take you a good 2 to 3 years to be able to build up the income to be able to pay off your student loans. So I wouldn't call it, the number one reason to apply for or look for a job in a community health center as a general dentist. I think it's one of the benefits of working full-time in a community health center.
All of us who live in Massachusetts know that it's a great state to live and work. We have great urban areas, we have great educational institutions, we have great opportunities for the cultural part of one's life, so that the people and individuals who want to have a well-rounded, balanced life have options.
The thing I enjoy about Boston is the proximity of everything. Things are, it's not so built up. Public transportation is nice. If I were living in Wisconsin, I'd more than likely need a car. I haven't had a car since 2002, and that's been a wonderful thing. And I enjoy the proximity to other parts of New England, too. I like to go to Vermont, go up to Maine. Parts of Rhode Island are enjoyable. So it's a nice place to take weekend trips, and New York isn't far away as well.
You can go to different parts of the state and have a completely different environment. You can have cows and horses and horse farms, and then you can go into the city and everything is lively and yeah, I think that you can just get a wide range of experiences living in Massachusetts.
We have a variety of dental health professional shortage areas in Massachusetts. People don't consider Cape Cod, but that's in fact a dental health professional shortage area. Out in the Berkshires, in the western part of the state, even in the city of Boston, we have areas that have been deemed dental health professional shortage areas. And those really serve as the platform for the low income and the residents of our state who aren't able to access dental care to be able to get dental care.
It's very rewarding. We have a lot of patients who require a lot of dental procedures, and people come in partially edentulous. They're missing some teeth, and we render services that bring their smiles back to life, and we bring them back to dental health, and that's the exciting part about it.
Helping people in need, how can you beat that? It's the epitome of being a doctor.